everybody, thanks for listening today. This is Haley Gibson. I want to talk to you today about rheumatoid arthritis and what it is exactly, and then how to beat it naturally. Basically, what rheumatoid arthritis is, it's an autoimmune disease, and it primarily attacks the synovial tissues and surrounding joints. Autoimmune diseases cause the body's immune system to mistake its own tissues for foreign invaders, such as bacteria or viruses. So the confused immune system develops antibodies to seek out and destroy the invaders in the synovium. So basically, it's doing its job. It's identifying something that's foreign and it's attacking it. However, it's mistaken and it's actually attacking your own body tissue. So this is a problem. So rheumatoid arthritis is a systemic disease, and it has the ability to affect the entire body. It can even attack many different organs like the heart, lungs, or other tissues like muscles, cartilage, and ligaments. It can cause chronic swelling and pain that is oftentimes severe, and it can also cause permanent disability. So it's a very serious illness that many people are struggling with today. So I just want to address arthritis on a deeper level today and help you overcome it naturally. So for those of you who don't know me, my name is Haley Gibson. I'm a professional nurse and functional diagnostic nutrition practitioner. Essentially what I do is I work alongside Dr. David Jockers, and I help develop health plans for people to overcome their health issues naturally. I worked in a hospital prior to working with Dr. Jockers, and I just realized that we're not really getting to the root cause of issues in the hospital. We're great for the acute care setting and keeping you from dying, but then we send you home living the same lifestyle that brought you to the hospital. So I became really passionate about helping people overcome that lifestyle barrier and figuring out how to live healthy and get to the root cause of their issues. So, and then the other pictures that you see there, they're just of my personal life, so you can see my fiance as well as some friends at the Mountain Challenge. So let's dive into this. Like I said, rheumatoid arthritis is an autoimmune disease, and it attacks tissues near joints and other body parts. It's a chronic disease, and it actually affects about 1% of the world's population. It occurs at twice the rate in women when compared with, and there's a prevalence of 1.06% in women as a percentage of the total population compared with 0.61% in men. So women struggle more so with this than men do. So this is essentially describing what is happening. So your immune system, there's different parts of the immune system that respond to different threats. For instance, whenever you have a cut, your body responds by sending things like neutrophils and macrophages to the area to help take care of that initial threat. But then you have an extended part of the immune system that it identifies things and makes like a lock and key system, meaning that it only attacks that one specific organism, but it is geared to destroy that one specific organism. And this is where your B cells come in. This is our humoral immunity. So basically, what I have here, you have a balanced immune system. You have an internal threat. For instance, say that your immune system starts attacking different tissues. This becomes an autoimmune problem. Things like Hashimoto's, rheumatoid arthritis, lupus, inflammatory bowel disease, type 1 diabetes, these are all autoimmune diseases where our body is attacking its own tissues. And then the external threat, you can have things come in to your body, such as a food sensitivity. Many people are sensitive to things like gluten or grains or eggs, maybe even nightshade vegetables, different things. And we'll talk more about this in a little bit. But basically, if you're sensitive to these foods, your body can perceive it as a threat and respond by attacking it. But sometimes these foods can mimic other tissues in the body, so the immune system can become confused and attack other tissues within the body. Allergies, eczema, asthma, sinusitis, all of these things are externally evoked. So asthma, typically you're breathing in some kind of, not a pathogen, but some kind of stimulatory things such as dust, and it can just set your immune system off. It can close up your throat, make you start wheezing, things of that nature. So that would be an immune overreaction. And then an underreaction would result in things like cancer, and then infection. Someone who has an underreactive immune system is very susceptible to infection. You know, those people who get colds every other month, they have a very underreactive immune system. So other symptoms associated with rheumatoid arthritis include fatigue, low-grade fevers, pain, and stiffness for longer than 30 minutes in the morning or after sitting. You may experience anemia or weight loss. So how does it develop? You can read the article for more in-depth explanation, but what I want you to get from this is that there are things called cytokines, which are part of your immune system, and basically they promote inflammation to help heal different areas, but this is a problem when it's causing inflammation in areas that don't necessarily need healing. So this is a vicious cycle here. So we have your antibody down here at the bottom. If you can see my mouse, you have your antibody complex. This is the one that is specific to the tissue, and basically it begins to attack the joints. And then the other things you see here, the tumor necrosis factor alpha, TNF, and then the interleukin 6 and 1, these are cytokines. And basically, they continue to promote inflammation. You can see interleukin 6 increases CRP, which is one of our heart risk indicators that we test for in lab work, and it also promotes T and B cell stimulation. So it's just keeping that inflammation going. Alrighty? So then we have the stages of rheumatoid arthritis. This is a picture of a healthy joint. You can see that there's a nice synovial membrane with a cavity that contains good amounts of synovial fluid in between those bones. So it keeps it cushioned and feeling good. Now, stage 1, you have an inflamed membrane. It becomes thickened, and the bones and cartilage gradually erode. So this is when it starts. There's typically no X-ray evidence of joint destruction at this point in time, but there may be swelling of soft tissues and possibly evidence of some bone erosion. So this is very early stage. And then the second stage, this is where inflammation has spread and it's affecting the joint cavity space across the joint cartilage. So this inflammation will gradually result in a destruction of cartilage accompanied by a narrowing of the joint. So those bones are getting closer and closer together, and this is painful. Then the third stage, this is marked by the formation of a pannus, P-A-N-N-U-S. I'm probably not pronouncing that right. Basically what that is, it's vascular scar tissue that extends over the surface of an organ or a joint. And this is in the synovium. So loss of joint cartilage exposes bone beneath the cartilage. These changes will become evident on X-ray along with erosions around the margins of the joint. Joint deformities may also become evident. So then you have stage 4. And this is known as the terminal or end-stage rheumatoid arthritis. Basically, the inflammatory process has subsided and formation of fibrous tissue or even fusing of the bone results in ceased joint function. This stage may be associated with formation of subcutaneous nodules. So this is extremely painful. So in order to address chronic inflammation and autoimmune disease, these are 12 different areas we really need to address. And we're going to discuss 20 ways to overcome. And this is where I'm going to start. And I will tie in the other areas in later slides. But first and foremost, we have to address blood sugar stability. The majority of us are eating something very carb heavy in the morning, or even just fruit. I know a lot of people are like, oh, I just eat fruit for breakfast. Well, that contains natural sugar as well. So essentially, we're raising something called glucose in the body. Glucose is what our cells use for fuel. So whenever this rises up, because we've ingested food, our pancreas secretes insulin, and the insulin pushes down our glucose levels by pushing the glucose into the cells so that we use it for energy. The problem is that big surges in glucose provoke big surges of insulin. Big surges of insulin make glucose crash down, and then our body becomes hungry. We get that hangry feeling, you know what I'm talking about, where you get a little headache. You might feel dizzy, you might feel lightheaded, but essentially our body is telling us that we need more food. So we eat, our glucose goes back up, our insulin comes out, pushes it down. So this is a big roller coaster. This is toxic for our body. We want our glucose to stay very stable. We do this by consuming healthy fats, healthy proteins, lots of non-starchy vegetables and herbs, and then low amounts of carbs. Carbs for what we need during the day, and this is different for everyone, but we don't need to overconsume carbohydrates. Vitamin D levels are crucial. We want to see these between 60 and 100 nanograms per milliliter. Gut dysbiosis is really big. We'll talk more about leaky gut in just a moment. Mitochondrial dysfunction. So basically, the mitochondria are the energy-producing organelles in each cell of the body. They are key in the body's ability to handle oxidative stress. So dysfunction here can increase free radicals. When I say free radicals, what do you think of? Most people say cancer. It also increases oxidative stress, which creates immune alterations as well. So many researchers believe that other autoimmune diseases like multiple sclerosis are primarily related to the mitochondria. So these are super important. Low glutathione levels. So glutathione is the major antioxidant within every cell of the body. It's critical for white blood cell production, white blood cell function, as the white blood cells encounter tremendous amounts of free radical and oxidative stress every second of the day. So low glutathione leads to chronic inflammation and often to autoimmunity. So we'll talk more about this as well. A lot of us have poor omega-6 to 3 fatty acid ratios. The majority of us have more omega-6 than omega-3s. The increased omega-6 stimulates the release of pro-inflammatory molecules known as prostaglandin, and this is a key factor in the development of chronic inflammation and autoimmunity. So we want to balance our omega fatty acid ratios. Cervical subluxation. Essentially, we want our brain to be able to communicate effectively with our organs. If we have something known as subluxation, or basically an area that prevents effective communication in the spine from your brain to your organs, if there's any kind of barrier is a good word for it, then we're not going to have good communication. Well, think of it like this. If your brain can't communicate to your heart, what happens? Your heart stops beating. So what if we just have like a little pinch on it, or we just have a little bit of subluxation going on? That can still impair function. There's not that full-blown communication happening there. So we really want to fix that. And then environmental toxins. So exposure to high levels of infectious microbes or environmental chemicals, like all of us are, they're impossible to avoid, but we do our best. So plastics, pesticides, herbicides, personal care products is a big one. What we're putting on our skin, we really need to be aware of it. Heavy metals, biotoxins, mold. Mold really wears down the body's glutathione levels. High stress, poor breathing. Basically, our body takes care of itself in our nervous system phase known as the parasympathetic response. Basically, what that means is we want our body to be in a rest and digest phase. We need to enter this daily. We don't need to be on a sympathetic, chronic inflammatory response to life, because this does not allow our body to heal itself. Rest and digest is what we really want to do. Lack of sleep, so we really need good sleep in order to repair our bodies overnight. Methylation is huge. Basically, you want to think of methylation as a key process that protects DNA. It turns on and off traits to help detox environmental chemicals, and many individuals have genetic polymorphisms that limit their ability to appropriate methylate. So it also plays a large role with T cell function, and poor methylation status is associated with the development of autoimmunity. And then EMF exposure. So if we're exposed to a lot of things like our phone lights, our computer lights, just fake light in general, or waves from things like microwaves, just all of these different frequencies of waves on a constant basis, this can promote confusion of the immune system as well. Let's talk a little about gluten. What is this about gluten sensitivity? You can see here it can cause a lot of damage in the body. It can result in many different things. So gluten is the common protein molecule found in wheat, barley, rye, kamut, and spelt. It's a sticky storage protein that binds to the small intestinal wall, where it often causes digestive and immune system disorders. So many people are sensitive to gluten and don't even realize it. Research has shown a high prevalence of gluten sensitivity in individuals with autoimmune connective tissue disorders such as rheumatoid arthritis, lupus, scleroderma, things of that nature. Studies have shown that a gluten-free diet has improved antibody counts and symptoms in many individuals with rheumatoid arthritis, and I can speak from personal experience with many of my clients. When we remove gluten and then other food sensitivities in addition to that, we see drastic changes in these people's health. A lot of time, their pain completely goes away. I've had people tell me, I haven't felt this good in 20 years, and it's incredible that all we did was manipulate their diet. So it's very exciting that we're discovering all of this and able to share it with the community. Many of them are just on things like steroids to help decrease inflammation, but that is very harmful for the body. And that's a whole other story. We won't go there, but it's very harmful for the body. Vitamin D, these are some good studies to look at. Basically, vitamin D is critical in the development of the immune system. There have been studies that shows that it helps with all sorts of things. These are just a few that were posted in this article. It improves depression, seasonal affective disorder, which is absolutely true. I can speak from personal experience with that. I started supplementing with vitamin D over the winter time, and I feel a million times better. I would get so depressed in the winter. It reduces the risk of Crohn's disease, rheumatoid arthritis, multiple sclerosis, as well as other autoimmune disorders, and that is because of its role in enhancing the body to do something called self-tolerate, and it reduces the risk of autoimmunity by doing this. It also stimulates the immune system to prevent infection. So it's really great. Basically, we want our levels to be between 60 and 100, like I said. Ideally, we're getting this from the sun. I know many of you are worried about getting melanoma, skin cancer. Well, we want to avoid being burned, and we want to avoid artificial light, so tanning beds is not the answer. But if you can get natural sunlight and use a natural sunscreen that contains zinc oxide as the natural ingredient, this is a great way to get in vitamin D, but also avoiding that risk for melanoma. We don't want our skin to get burned. The ideal amount of time out in the sun is about 30 minutes a day, and we want our trunk areas exposed. So that would be our thighs, our stomach, and our back. Most of us are not getting this. So on days where I can't be in the sun, which is a lot of days right now because I'm in school as well, but you want to supplement with a vitamin D supplement that contains vitamin D3 with K2. You want to take this with a fat source in the morning. It does have a slightly stimulatory effect. So yeah, you want to take that in the morning so that you don't stay up at night. I think that's it there. Oh, a good dose would be good to talk about. Most people do well with 5,000 IUs. This is a good maintenance dose. If you are low in vitamin D, let's say you have a level of 30, we would most likely increase that dose up to 10,000 IUs and maybe even 20,000 IUs short term to help boost you back up into that therapeutic range. So let's talk about the gut flora. The gut microbiome is made up over 1,000 different species. You have more bacteria in your gut than you have cells in your body. It plays a huge role in our mood, our cravings, our digestion, our nutrient absorption, and all of this affects how we present symptomatically. Oops. Sorry about that. Certain bacteria of the gram-negative classification actually release something called a lipopolysaccharide, which is highly inflammatory for the body. Researchers have found that people with rheumatoid arthritis have high levels of the gram-negative bacterium known as Prevotella copri. This is correlated with an increase in that lipopolysaccharide protein I just spoke about. A lot of these people are actually deficient in good, healthy microbes as well. So we want to make sure that we're getting a good amount of fermented foods as well. Many people with rheumatoid arthritis also struggle with something called small intestinal bacterial overgrowth. Essentially what this is, if you think about your stomach being connected to your intestines, you have your small in between your large intestine and your stomach. So your small intestine is where the majority of your food absorption happens. Well, what happens is the bacteria should remain in the large intestine for the most part, but sometimes this will overgrow up into the small intestine for many, many reasons. But this is not a good thing because then our foods can be fermented too early. This can result in poor digestion and immune issues, poor metabolism, and then poor nutrient absorption. So when all this is happening, we also release more lipopolysaccharides into the small intestine, and essentially this overwhelms the liver. It overwhelms the immune system, so it can leave you at risk. Then leaky gut syndrome. I'm going to make this short and sweet. So basically we have tight junctions in between the cells of our intestinal mucosa. This prevents things from getting through, like big proteins or bacteria, medications that we're taking, any kind of food, this sort of thing, toxins. Basically, that mucosa is supposed to absorb our foods as well as prevent other toxic things from getting through that barrier. What happens is this will be torn down by all of the triggers you see up there, dietary proteins, low stomach acid, antibiotics, infections, blood sugar issues, pregnancy, menopause, toxins, food allergies, and stress. Now, some of this we can't avoid, but we need to avoid what we can. So basically, this will tear down those tight junctions, and then things can get through and go directly into the bloodstream before they are broken down in our digestive system. So this causes a lot of immune issues, and it burdens our liver very much so. Okay. And then mitochondrial health. What I want you to get from this, like I said, is the powerhouse of the cell. But in rheumatoid arthritis, the cells are under so much stress that their main protective shield, known as glutathione, gets worn down, and oxidative stress damages the mitochondria and the DNA, leading to cell death. So poor blood sugar control and high environmental toxin exposure, these are known to deplete glutathione levels and impair mitochondrial function. So with all that being said, now you know kind of why it happens. The accumulation of several things. Rheumatoid arthritis isn't one of those things like this is a direct cause of your rheumatoid arthritis. A lot of times it's an accumulation of effects. Now, some people it is, like you take out gluten and it completely goes away. For most people, it's more complex than that. Gluten is a great place to start for sure. So what do? 20 lifestyle strategies. So we kind of talked about the diet a little bit. This is what we want our pyramid to look like. We want the foundation to be lots of good, healthy fats, avocado, coconut oil, grass-fed butter, things of that nature. And then after that, we really want to have a lot of non-starchy vegetables, lots of herbs and low glycemic fruit like berries and lemons and limes. Clean protein, so the quality of your protein matters so much. There's a huge difference if you compare conventionally fed beef to grass-fed beef. There's a ginormous difference. So please get grass-fed beef, wild-caught salmon, pasture-raised poultry, or wild game. All of this is great. So real quick, nuts and seeds. Most people, when they start eating a healthy diet, return to eating a lot of nuts and seeds. I want to encourage you to keep it to about 1/4 a cup a day and focus more so on the vegetables and healthy fats. Reason being, these are harder on your digestive system, so we really don't need a lot of them. Fermented foods. If you can tolerate these, I would either take a good probiotic or start using fermented foods in your diet on a daily basis. Start with some kimchi, pickles, sauerkraut, coconut milk, yogurt, things like that. And then natural sweeteners, we really want to stick to stevia and monk fruit for the most part, as they don't affect your blood sugar like these other things do, like raw honey or grade B maple syrup and coconut sugar. Okay. Let's see. So organ meats are really great to use. So grass-fed liver, heart, these are rich in mitochondrial support nutrients. Powerful herbs like turmeric, ginger, garlic, onion, rosemary, thyme, cinnamon, oregano. If you do have rheumatoid arthritis, I would strongly encourage you to use things like turmeric and cinnamon on a daily basis. These are highly anti-inflammatory and definitely help with pain. Consuming lots of sulfur-based foods like onions, garlic, cruciferous vegetables, these things are great for getting in some good nutrients to help overcome rheumatoid arthritis. And then you also want to use something like fish oil to help you get in those omega-3 fatty acids. So we also want to rebuild our intestinal wall. I talked about leaky gut. I talked about gluten. I talked about bacterial overgrowth. So how do you rebuild that intestinal wall? The best way is to utilize a liquid diet where you're consuming only liquids for about 16 to 20 hours on a daily basis. Basically, what I mean by this, you want to use something called intermittent fasting. So start by just doing 12 hours between dinner and breakfast. So if you eat dinner at 7, eat breakfast at 7 the next day. See how you do with that. And then utilize liquid nutrition. So lots of good protein shakes, green juices that have good things to help you stimulate bile. So Swiss chard, ginger, radishes, celery, cucumber, lemon, things of that nature. You want good high quality shakes, so you want berries, coconut, coconut milk. You want a good hypoallergenic protein powder. No more than 1 solid food meal a day should be consumed for at least 3 months to really ensure that you're healing your gut properly. You can also incorporate a 6-week liquid diet completely to really remove that stress off the gut and help heal that intestinal lining. Vegetable juices are awesome. Cabbage is loaded with the amino acid L-glutamine, which is the primary amino acid in the intestinal wall. So if you can supplement with L-glutamine, that's really great to help rebuild that wall. A base dose would be 5 grams. I've even increased people up to 20 grams daily of L-glutamine. Digestive enzymes and fermented foods, these are used before or during the solid food meal to enhance digestion. Heavy-duty probiotic supplementation can be used in the evening after the solid food meal, and that reduces inflammation. Okay, so let's talk about some of the other ways. We've talked about diet. I would encourage you to consider an autoimmune protocol or a low oxalate diet. We have both of these on our website if you want more information about them. So I'm going to briefly touch on them. The autoimmune protocol, essentially what we do is we take out eggs, grains, sugar, nightshade vegetables, gluten, legumes, I'm sure dairy. I'm sure I'm forgetting something else. But you take these foods out and we give you a meal plan and recipe guide. Okay, we took all these things out. Now what do I eat? Well, we tell you what to eat. Here's your approved food list. But a low oxalate diet is also good to consider. Yeah, another thing you can do is test for food sensitivities. This is highly encouraged if you're struggling with an autoimmune disease because you want to pinpoint what foods are contributing to inflammation. You want to see what your immune system is responding to. Reducing stress, getting outside, getting in vitamin D levels, being at one with nature, and really finding time every single day to be calm and resonate with life and reflect. This is really great for healing. Improving your sleep. You want to get at least 8 to 9 hours each night. Be sure you're going to bed early. Try to go to bed around 10 and then rise with the sun around 6. This is your most restorative sleep. You want to power up your antioxidant pathways. So using things like resveratrol, curcumin, green tea, all of these things are really great. We also have supplements that boost up these naturally as well. Magnesium and B vitamin rich foods are really important for that methylation that I was talking about earlier. So magnesium is great for improving blood sugar signaling patterns, and it also protects the blood-brain barrier. So the best magnesium and B vitamin rich foods include dark green leafy vegetables, grass-fed dairy, raw cacao, and pumpkin seeds. You can also do an Epsom salt bath to increase your magnesium levels. Focus on deep breathing. We really want to slow down, kick our bodies into that parasympathetic response, that rest and digest system that we spoke about. So you want to slow down, multiple times a day, once an hour. Just make yourself take 10 deep breaths and relax. You'll be amazed at how this actually affects your health. Lots of antioxidant-rich herbs, which we've talked about. 2 potent ones for rheumatoid arthritis would be cinnamon and turmeric. Grounding your body, we've talked about trying to remove yourself from all these harsh fake lights. We really want to be around natural lighting, decrease our exposure to our cell phones and our computers the best that we can. I know we live in a technology-based world, so just the best you can. Supplement with omega-3 fatty acids. Personally, I like to use Pro EFA from Nordic Naturals. I trust them. They are a good source. A lot of times we are concerned about the quality of our fish oil and if there's any heavy metals or toxins in them. But Nordic Naturals is a great brand to use. You can find that at drjockers.com as well. So you want to improve your mitochondria. We've talked a lot about that. So how do you do that? Basically, you want to get in good doses of CoQ10, L-carnitine, N-acetylcysteine, and lipoic acid. So what we use is something called Brain Supercharge. You can find this at drjockers.com. Basically, it boosts up your antioxidant pathways and it helps your mitochondria perform better. A chiropractor is a great idea. If you have any sort of subluxation, just get evaluated, see how your spine is looking. Juicing your vegetables, great way to get in powerful phytonutrients. And then intermittent fasting. So I said let's start with 12 hours, but going 16 hours between dinner and breakfast is one of the best ways you can improve mitochondrial production. So that's one thing to consider. Oil pulling is really great. So this helps reduce the microbial load and it takes stress off the immune system because coconut oil is actually an antimicrobial. So you can do this twice daily. Basically, get some coconut oil, get it to a lukewarm temperature where it's liquid or almost liquid, and then you'll swish this around in your mouth and then spit it out. You can swish it around for about a minute and then spit it out. A good home water filtration system. So we want to avoid chloride, fluoride, pesticides, heavy metals, all these things that are in tap water. So you really want to be getting a whole home water filtration system. And something we use is reverse osmosis water. You can find more information about this by emailing me at nutrition@drjockers.com. That's nutrition@drjockers.com, or you can visit the website. Using essential oils, so this antioxidant, the antioxidant content and aromatherapy benefits of essential oils helps to improve oxygenation, and it reduces the harmful effects of oxidative stress. So some favorites, you can use lavender, peppermint, chamomile, sweet orange. These are all really great. So put a drop on your hands and mix together, and then cover your nose and inhale the vapor. So this will stimulate your brain and increase blood flow to your cranium. Low intensity movement. So I know when you have rheumatoid arthritis, you don't really want to move. It's painful, but actually, if you get up and you're able to move around, this actually helps with blood flow. So things like walking and cycling, playing, regular movement will help reduce inflammation in the body, and it helps stabilize the joints to boost the development of new neurons in the brain. So moving. Make sure you're walking daily, cycling, swimming. These things are low impact and really great for your joints. It will help you feel better. So definitely encourage that. And then the last one, improve your gut motility. So bowel movement frequency and consistency is a key part. We've talked about the diet. Some other things you can use are bone broths, fermented foods. I didn't really talk about the low oxalate diet, so I think that's the last thing I'll talk about, which is my go-to when people present with rheumatoid arthritis, or if they've had gallstones or kidney stones. I really encourage a low oxalate diet. You can find more about this on drjockers.com as well. But essentially, oxalates are found in healthy foods. They're found in things like spinach, cacao nibs, sweet potatoes, healthy foods. But the problem is when oxalates bind up with other things, you can have calcium bind up to it, vitamin C. If you have yeast overgrowth, they're more likely to form little crystals, but these crystals can become stones, and they can lodge into synovial tissue, causing pain. They can also lodge into the gallbladder, causing stones, or the kidneys, causing stones. They can also land in your eyes. So if you have like maybe an itchy eye feeling, that could be something going on, something to consider. So essentially we take out higher oxalate foods and focus on healing the gut lining. So I've thrown a lot at you today. I hope you got something out of it. If you would like a more concise plan, something, this is how you eat, this is the diet, this is the supplements, if you need something like that, someone to guide you through the process, feel free to email me at nutrition@drjockers.com. I'd be happy to help you set up a game plan, review any lab work that you've had done. We work with people locally as well as over long distance. So if you would like a phone or Skype consultation, we're totally available for that. Thank you for watching. Have a great day.